Well, that was a taste of debate in the House of Commons last week, where the focus was on drug decriminalization, and that was before members left town for their week in their ridings. It was the last break week before a 5-week push to the summer. It all gets back underway on Tuesday. So let's bring back our front bench panel on what to expect. Karleen Varayan, Melanie Paradis, Gurritin Singh, and Rachel Aiello. And just a reminder about our breaking news. Mental Health and Addictions Minister Yara Sachs has officially rejected Toronto's decriminalization request. Health Canada saying in a statement, in part, she is determined that it does not adequately protect public health and maintain public safety. And this includes concerns with feasibility and the ability for law enforcement to implement the proposed model, protection of youth, and the lack of support from key players, including the province of Ontario. Okay, this is breaking news, but Karleen, get your reaction to this and what this might do to the debate in the House of Commons going forward.
Well, there's no doubt that with a vote looming when the House comes back next week on a motion, a non-binding motion, but nonetheless a motion regarding drug decriminalization, that this is a way for the Liberals to preempt that, sort of take the political gas out of it. There's no doubt that there's a lot of evidence out there that outright criminalization of hard drugs doesn't really do a whole lot for public health. But at the same time, when you are the government and you're a government who believes that, at least to some extent, you still have a very careful dance that you have to do with other levels of government. I think what was really clear in that statement and what the Liberals are probably hoping they'll be able to skate by on with that part of their base that does support decriminalization as a harm reduction measure is we couldn't get Ontario on side. And there's no way to do this safely without cooperation of all levels. But I do think that it accomplishes the immediate goal of sidestepping this issue next week in the House of Commons. What I would hope to see is that there are still measures coming down the pipeline that will protect public health in the city of Toronto, where the overdose crisis is pretty serious.
Yeah, and Rachel, you've been following this, and that vote was supposed to happen next week. And, one would think that maybe, it doesn't happen. I don't know. What do you think?
Well, just by the rules, the opposition motion will have to get voted on. But certainly I do think what has just been announced today has taken some of the wind out of the sails of the Conservatives, who were going extremely hard on this issue in the House over the last number of weeks. That motion specifically called for the federal government to not approve Toronto's request and further reject Montreal's request for a similar measure. And so certainly I think what's interesting about this, Mike, is that I noticed it earlier in the week hearing from Poilievre, and then I asked Andrew Scheer's office, the Conservative House Leader, what their priorities are going to be heading into the rest of the sitting. I'm working on a piece, you can catch that on ctvnews.ca over the weekend, about House priorities. And left out of his statement was any mention of drug decriminalization. So I do wonder, with what we saw the other day about the pivot back to cut all the summer gas taxes, give us a break, and not pushing this so much, that maybe the Conservatives are noting it's not playing so well for them, and they're going back to those cost of living issues. Yeah,
Melanie, speak to that a little bit, and how, knowing now what what has happened now with the government and the rejection of this plan, how does that change the calculation for Pierre Poilievre and the Conservatives when they come back for this 5-week stretch?
Well, I actually think this is a win for Conservatives, certainly because they've been pushing this agenda. It's also a win for Premier Doug Ford, who earlier today had sent a letter to the federal government calling on them to do exactly this. He clearly has a strong relationship and is well respected. When he asks for something from the federal government, they take it very seriously, because he understands how Ontarians are feeling about this issue in particular. I don't live in Toronto. I live in small town Ontario, in Belleville. And we, a few months ago, unfortunately, were on a lot of front pages across the country because we had an overdose crisis here as well. There were, I think, 13 people who were taken to hospital in a 1-hour period from downtown Belleville as a result of drug overdoses that thankfully they were all saved. But we don't even have 13 ambulances in our city. We had to pull ambulances from all around the region to help save these people's lives. That's how crazy this crisis is, and it's impacting communities across this country, not just in Toronto. So I think politicians are finally coming to the realization that decriminalization isn't what we need. We need to get these drugs out of our cities. We need our police officers to have the powers that they need in order to go after the criminals who are bringing these drugs into our communities and altering lives for the worse everywhere in this country.
Gurritin, how do you think that it changes the debate going forward for those last 5 weeks in the House of Commons?
What I have to say is that whenever this issue comes forward, or any public health issue, part of me thinks that I really wish that these were not politicized, and instead that healthcare issues had a healthcare response. And when we look at, of course, we need to ensure that drugs are not being available to people on the streets and people in communities and people across the board. But on that same note, we know that the criminalization of drugs rather doesn't actually help prevent people from it doesn't stop people from their usage of drugs, and often it can exacerbate the issue. So I think the issue will largely no longer be at the forefront because we already have a decision coming forward. But as a whole, my response to it is I just wish, in general, we had less politicization of healthcare issues, and these were left to healthcare providers to provide the direction that we need to address crises that we're in right now.
Okay, Karlene, let's fully focus on what we're about to see in this stretch run. Rachel affectionately refers to it as silly season in the House of Commons. I think we all do on Parliament Hill. But what do you expect to see from the Liberals in the next 5 weeks? And do you think that Justin Trudeau needs to show to his caucus that he still has the fight in him so that when they go on that summer barbecue circuit, that they are talking him up to all their constituents and saying, yeah, he's the guy who's going to stick in this fight?
Well, that bump in the polls that we talked about a little earlier doesn't hurt. But 5 weeks is a long stretch. There's a lot that can happen. I think you'll see both major parties actually probably doing a lot of the same things that they've been doing for the last number of weeks, because from both the Conservative and the Liberal perspective, I think both sides have reason to believe that what they're doing is working. So I think you'll see from the Tories a lot more axe the tax, build the homes, bring it home, fix the budget, whatever it is.
Stop the crime.
Yeah, you'll see Trudeau continuing to push on raising taxes for the richest people in our country. Maybe more of that axe the facts slogan that he test drove this week. I also think, though, that, by the time we get to next Tuesday and Parliament resuming, probably the country is still on fire, at least half of it. And that's only going to get worse over the coming 5 weeks. We're going to start seeing flood season come as well. So as these extreme weather events get worse and worse and worse every year, I do think that it is becoming increasingly difficult for any political party to ignore the link between climate change and lack of climate action and these fires and floods that are causing billions of dollars of damage to our communities. So I actually am very skeptical that Poilievre's, get rid of the carbon tax for the summer so that we can all fill our cars full of gasoline message is really going to land that well in communities, particularly in Western Canada, but also in Quebec, where people are having to evacuate their homes because of smoke or fires or all of these things.
Melanie, talk about that calculation and whether or not what he test drove with that policy will sort of drive on throughout the next 5 weeks.
Yeah, absolutely. So around the carbon tax in particular, like this weekend's a great litmus test for the barbecue season of the summer that you're talking about. People are going to be out filling their propane tanks this weekend and turning their barbecues on for the first time in a while, because it's the first long weekend that we've had where hopefully we have some good weather. And they're going to be surprised by how much that propane tank costs them this time around. They're also going to be talking while they're at the grill about how their interest rates on their mortgages have not yet gone down, that the cost of living continues to be high. And the other thing they're going to be talking about is, why is Justin Trudeau not stepping down? I think that by the end of the next 5 weeks that we're going to see, a real increase in pressure. We're already seeing like Mark Carney and Melanie Joly out testing the waters to see if they have leadership potential. And we're going to see a lot of pressure mount on Prime Minister Justin Trudeau to decide whether he's actually going to stay in this or not. This is the time for him to decide if he's going to step down and let there be a leadership race, because it takes about 100 days to run one of those nationwide. So they could start it over the summer, but he'd need to decide that before July 1st. So I think this is do or die time for the Liberals.
Okay, go to 10. I got about 30 seconds and you'll get that.
Very quickly, I'll say for the NDP, what the NDP is going to want to see is the pharma care coming into play, the dental care commitments come forward. We want to make sure that we're having that accessibility to birth control, to diabetes devices and diabetes medication. That's going to be, I think, a primary focus for the NDP over the next 5 weeks.